Lisa Gill joins us, Consumer Reports. She's the Deputy Health Director. Good morning, Lisa Gill.
Good morning.
You have done a study, Consumer Reports has, about the price of prescription drugs. What have you found?
We found that the amount of money people are paying out of their pocket is rising, and it is rising fast. And not only that, when people are faced with an increased price of their prescription medication at the pharmacy counter, they often don't fill the prescription because they can't afford it. Even small increases, $10, $20, $40, people will walk away from their medications. It is surprising.
Is this because they don't have insurance, the insurance doesn't cover it, or what's going on?
Right. So, actually a lot of Americans have some kind of drug coverage, which is great. But the problem is it's not always very good coverage. And in fact, more Americans than ever, particularly ones that get their insurance through their employers, have something called high deductible insurance plans. And that means that you've got to shell out at least $1,300 often, and sometimes much more than that, before your insurance even kicks in. So, a $20, $40, even a $100 prescription, you'll be on the hook for the entire amount, which can be really tough.
What about the Affordable Care Act versus traditional through your employer insurance? Did you see any differences there?
Well, we didn't delve down that far because we were really just trying to understand, hey, what's happening across all Americans when they go to the pharmacy. But I will tell you one thing that we did that was incredibly surprising, and that is we sent out secret shoppers across the country with a market basket of 5 drugs to find out, hey, how much can these things cost? And it turns out, even within the same zip code, very common generic medications, things like generic Lipitor and generic Plavix, stuff to treat cholesterol, high
Sure.
cholesterol, and things like that. There can be price differences 10 times difference in your area. So we encourage consumers, look, if you're going to use insurance but you can't afford it for some reason, start calling around and asking your pharmacy, hey, what is the lowest possible price you can give me? Which is why we have declared this coming Saturday for the entire week, National Save Money on Your Meds Week. And we got stores like Costco, Publix, also the National Community Pharmacists Association, all the independent pharmacies, to support it. And the idea is that you go into a pharmacy, take all the medications that you have, or take a list of them and ask your pharmacist, hey, can you give me a better deal? Can you get me, what's the best price you can give me? And they might be able to help you.
Hold on a second. You're saying that you, Consumer Reports, went into the same zip code and you found the same drugs at different prices depending on where you went?
That is exactly right. We saw prices go as low as, we'll say, $16 for a generic Actos, for example. That price sometimes went all the way up to $270, just within blocks of each other. It is an astounding finding. We do the survey every couple of years just to make sure this weird thing in the market is still going on, and unfortunately it is. So it means if you're not going to use insurance, call around and find out. Ask directly, what's the lowest price you can give me? Because some of these pharmacies might be able to try to work with online discount coupons and any of the discount programs that they have to help lower that price for you.
You know what's amazing is I would go from store to store to try and find a cheaper price of a 6-pack of diet soda. But I would never think to go to a different store to find a cheaper medicine.
No, you know what? You really shouldn't have to. And to me, it's utterly shocking that something that should be just a couple of dollars, like generic Lipitor, for example, truly we found it in some cases as low as $8, and in one little area like an independent pharmacy. And if you start calling around, you could find it for $140 or higher, which is just it's outrageous.
Yeah,
it's outrageous. So you got to ask. National Save Money on Your Meds Week is this Saturday for 1 week. Of course, you can always ask your pharmacist, what's the lowest price you can give me? But definitely ask. Have that conversation. Your pharmacist is there to help you.
Right, but ultimately the pharmacist, they can say to you, well, the price is the price, right? Just like if I'm buying a 6-pack of diet soda, the clerk's
Right.
not going to tell me, hey, I can take $5 off of your soda.
You'd be surprised. So a lot of pharmacies have in-store discount programs that they offer. We have found that many major retailers, many major like national chain drugstores offer discount generic drug programs. And you may not realize that you're just for a couple of bucks a month without using insurance, you may not realize that your medication is on that list. So you have to ask. Otherwise, they will default to using your insurance. That's in the contract that they have to do that. So we instruct consumers, ask them for the lowest possible price. That will enable them to go outside your insurance and start looking at what are the actual retail prices for that medication. And it's hard to believe. Sometimes your insurance, and I know this is a mind blow, but sometimes your insurance actually charges you more money than what the pharmacy charges.
Wow.
This is crazy.
Lisa,
that's why you really got to ask.
Yeah, Lisa Gill, Consumer Reports Deputy Health Editor. Is there more online about this in your magazine?
There is. ConsumerReports.org. It's a cover story, just came out yesterday. It's all free on the website because it's such an important topic.
Lisa Gill, great stuff. Thanks for checking in.
Thank you. Take care.
My mind.